Good morning, everyone. Thank you so much for joining us. We are grateful for this space and grateful for our presenters this morning. So the topic for today's webinar is supporting families during COVID-19 and emergencies. For those of you that are not familiar with Health Connect One, we are a national leader in advancing respectful and community-based peer-to-peer support for pregnancy, birth, breastfeeding, and early parenting. So we're a national non-for-profit that does training and consulting around maternal child health. This webinar is possible by the W.K. Kellogg Foundation. So we thank them for the support and to be able to make these webinars possible. This webinar is being recorded. You are in listen-only mode. We encourage you to use the chat feature to share comments and questions. For technical issues, please use the chat box. Helen and Sadie White will be managing that for us. You will also receive a survey via email and in the chat box that we encourage you to fill out. And I will hand it to Helen.
Good morning, everyone. Helen Demas here. First, I want to start by, as you've seen, that we are partnering with ASI, or Alimentación Segura Infantil. And ASI was founded in 2017 with the purpose of responding to the infant and young child feeding inequities related to the disasters and systemic oppression that exists. It's currently the largest community-based nonprofit of its type in Puerto Rico and one of the foremost experts in IYCF and E in Spanish and in the world. Our focus, or their focus, is on community training and direct services in lactation, relactation, complementary feeding, and safer feeding with human milk substitutes. ASI provides affordable certification in lactation and infant feeding training and provides clinical hours for individuals wishing to become IBCLCs or lactation specialists in their own right, focused on community-based involvement with centered marginalized populations as experts. Our speaker, Lourdes Santabaya, has been a community-based doula and a prenatal educator, lactation peer counselor, and an IBCLC for over 10 years. In October of 2017, she and Yayeli Concepcion Morales, a doula and peer counselor, co-founded ASI to deal with the infant and young child feeding inequities and lack of peer support, which became evident after the hurricanes Irma and Maria. Also presenting will be Carmen Gabriel. She's been a community-based lactation peer counselor and IBCLC for over 25 years. She's the founder of Lacted and joined the ASI team in November of 2017. She's the coordinator of Mentorship and is looking forward to the day that she and Lourdes are not the only community-based IBCLCs in Puerto Rico. Mariel Alvarez is a doula and community-based lactation peer counselor. She's certified by the Red de Doulas Mundial as a doula educator, having prepared hundreds of community-based doulas in Puerto Rico and diaspora. She is the education coordinator at ASI. I'm going to hand it over to Lourdes. Unmute yourself, Lourdes.
Did it work? Did I unmute myself? Okay, perfect.
Yes, we can hear you.
Okay, perfect. Thanks for being here. And I am not going to be answering questions during the presentation. So if you want to save them until the end, I am going to be doing the presentation, but I want to make it very clear that this was prepared by Carmen Cabrera, Mariel Alvarez, and myself. We're ASI. Just to let you all know, we don't have any conflict of interest in the preparation or the review of this presentation. And essentially, what do we want you to get out of this? We want you to understand what are the unique needs of infants and young children during a disaster and after a disaster, so that you can become first responders and be prepared in advance during and after any situation, especially services which are culturally and linguistically appropriate. So we have a global situation, and this might be a good place to do the waterfall. I'm going to ask and I'll say go. How do you think that changes in climate, natural disasters, human conflicts, and pandemics are impacting lactation and safe infant and young child feeding? 1, 2, 3, go. Want to clarify what disaster and state of emergency are. A disaster is a sudden and calamitous event that causes damage, destruction. This can be a result of natural or human events. And a state of emergency is what's called after a disaster situation. And depending on what your government is, this can happen at a county, at a regional, at a state, at a municipal, at a federal, or an international level. Up until now, we've been dealing with a lot of state and regional crises, but 2020 has been unique, and now we're dealing with an international crisis. There's two types of disasters. A natural disaster, basically, it's something that's caused by nature, or biology, but something that would disrupt our daily lives. Whereas a human-made disaster would be caused either by a direct human act or something that a human has created that fails. We found these maps off of the Washington Post and thought we would share them, but this is just maps of specific types of natural disasters in the United States. And sorry, Washington Post didn't think that Puerto Rico deserved to be on the map. But this is a fire map, so this is just fires in 2019 in the US. These are floods. This is the geologic map, and geologic means earthquakes, geyser explosions, volcanic eruptions, any kind of ground movement. Lightning map. Extreme temperatures, going from hot to cold. Winds would include tornadoes and those straight line winds, anything that a wind type of situation. And you can see we have a tornado alley here. And we wanted to share this. This graph here shows you the absolute number of annual deaths, global deaths from natural disasters, but it goes from 1900 to 2000, and then the 6 years since 2010. And if you look at I can't think of the word here, the color coding is what I'm going to say. It used to be back in the 1900s that a lot more deaths were happening because of droughts. We had a period of time where flooding was a cause, and then droughts again, and then flooding again, and then droughts again. But we've had a change. If you see suddenly from 1970 to now, that deaths that are related to earthquakes, storms, and extreme temperatures are definitely on the rise. You could kind of suppose maybe why that some of these earthquakes really becoming more frequent. It may have to do more with housing, with the structural issues of how people are living close together. But there is no doubt when you look at this graph that the reason that people are dying from natural catastrophes is changing. And just to give you an idea, there's so many types of human-made disasters, and we've seen them happening. They are happening. They will happen. I remember reading in college a book called Natural Accidents, and essentially the theory was wherever there is any kind of human technology, it's inevitable that a disaster could happen as a result. To give you an idea, we also put together some disasters from the past 3 years. We had Hurricane Harvey in 2017, and I'm gonna say casually, this was around the time when I first became aware of the term IYCFE and started working on the issue. Then there was Hurricane Irma in September of 2017, which primarily affected or devastated the Leeward Islands in the Caribbean. It hit part of Puerto Rico and then also affected Florida. Hurricane Maria, which devastated Puerto Rico, also in September of 2017. In 2017, October, there were a series of wildfires, and here we weren't geographically specific. I don't know if anybody had an opportunity to see like a satellite map, but literally it spanned the globe: Asia, Europe, Australia, North America, very expansive wildfires. Then there was Hurricane Florence in 2018. You remember this affected South Carolina and North Carolina. And even though it wasn't a high category storm, there was a lot of rain, and housing conditions related to inequity meant that a lot of people were displaced. There are still people who are dealing with the effects 2 years later. Hurricane Michael was another category 5, and this affected Florida, the panhandle area. The California wildfires in November of 2018. The polar vortex, which was an extreme cold, it affected North America, and it also affected North Europe and North Asia. So it just took that upper part, but the northern portion of the globe. Alabama and Southeast United States also had tornadoes in April of 2019. Then some tornadoes in May of 2019. Hurricane Dorian, which we remember how it affected the Bahamas in September of 2019. The Australian bushfires, which seems like it was just yesterday, we were reading about that and the IYCFE efforts that were going on in Australia in September, just a few months ago. Then the California wildfires, which happened kind of simultaneously, but a little bit after. The Amazon wildfires in November of 2019. And then in December of 2019 is when we first heard of COVID in China, which quickly started to spread to Europe and then to the Americas. In Puerto Rico, we had earthquakes which started in January of 2020, and those are still ongoing. In Michigan, there were some dam breaches in May of 2020. So all of this is happening in a very short period of time and together. And then the southern border humanitarian crisis is ongoing. We know that this crisis has existed ever since they decided to draw an arbitrary line and say, you live in this country and you live in this country. But it's been coming to a head due to some of the past and current administrations, the way that they've been handling the situation. And all of these situations that we've described have resulted in infants and young children in danger of safe feeding. We've had some tornadoes just recently in June of this year. And currently we're also experiencing some civil unrest, which can result in the separation of parents from their infants and young children, as well as unfair and inequitable conditions. And the question we say is, well, what next? What's going to happen next? Because 2020 has been very intense. Are you prepared? We put this together just as a something to think about before we get into the nitty-gritty. But what we suggest, and there's not one place, but that you be aware of your surroundings and know your risks. Every region has its own individual risks, although you already saw some of the human-made disasters that could happen anywhere. Make sure you have enough water and food. Protect yourself and protect your family. Communicate with your family in school when necessary. Community involvement is so important. And if you have all of these components, ideally, then you'll be able to live with resilience during any disaster situation. One thing that we do know is that even without disasters happening, breastfeeding is already an unstable situation. The United States keeps records of breastfeeding and lactation rates via the breastfeeding report card. The last breastfeeding report card that was made was in 2018, and it compiled statistics from 2016. This year's breastfeeding report cards has still not been published. But here are some things that do come out of that last breastfeeding report card, that the rates are rising. 4 out of 5 infants were put to the breast, and over half were breastfeeding at 6 months, and more than 1/3 were breastfeeding at 12 months. But these are non-exclusive breastfeeding rates. In reality, the US average for exclusive breastfeeding at 6 months is about 24%, and it's lower for 12 months. Although at 12 months, hopefully you're doing some complementary feeding. This means that a lot of babies in the United States are being formula fed, even if they're being breastfed. And also there are a lot of differences. For example, Alaska has the highest breastfeeding rates at 69.2, whereas Mississippi has 35.4. And we know that there are very marked racial and ethnic disparities. For example, African American babies are the least likely to be breastfed. And even though there's this myth that Latinx babies are most likely to be breastfed, they're also the most likely to be combo fed. Despite the high breastfeeding initiation rates and the fact that things are improving, nobody met the goals for Healthy People 2020. And those goals, in my opinion, were not very high, the targets. And right now, as we're dealing with the COVID crisis, it seems to be causing lower rates of lactation due to the medical treatment of birthing and lactating bodies as dirty, and a lot of separation of breastfeeding diets. The one thing we know is that your IYCFE is only as strong as your IYCF. What is IYCF and IYCFE? IYCF is infant and young child feeding, and IYCFE is infant and young child feeding in emergencies. There needs to be some sort of infrastructure during times of stability, because there has to be a coordinated plan in place for the disaster in order to be able to respond effectively. Sadly, a lot of people assume that babies are fine because they're with their mothers or their caregivers. But the other thing they think is that if the parent is starving or malnourished, that then breastfeeding or chest feeding has to be interrupted. And when people think of sending help after a disaster to babies, the first thing they think of sending is infant formula. I think that this is cultural because we live in a bottle feeding society. I also think it's because people want to help. And the fact is, you cannot buy a lactation professional in a store. You can't put that in a box and ship it to a place where there's been a disaster. Although there are experts on the ground and you could send money or supplies to those people. Breastfeeding can be sacrificed within 48 hours of an emergency. There's so many things that are going on that literally, if you don't respond fast and have a plan in place, a lot of families could interrupt the breastfeeding after any disaster. And formula feeding in general is dangerous, but it's a lot more dangerous during a crisis. Knowing that infants are 100% dependent on adults to survive, both nutrition and hygiene-wise. Some of the findings that ASI had after the disaster is that basic goods were scarce and help delayed to arrive. There's long lines, and long lines, as we're seeing right now, even to go grocery shopping, to go and buy some basic goods, means that maybe a baby is at home and a parent is in line. And if that line takes a long time, you may become engorged. Somebody at home is taking care of the baby, and that would be one place where breastfeeding can be sacrificed. Infant formula is literally airdropped to cut off areas, and it's distributed by a lot of these food pantries even when the family doesn't request it. So you go, they ask you who's in the family. You say, oh, there's my wife and my mother-in-law and the baby who's 6 months old. And they ask you, what kind of formula do they eat? There's also lack of or non-existent lactation support or education for anybody who needs it in the shelters, in help hubs like the FEMA centers. There's not access to kitchens or private space to express milk or to prepare infant formula according to the World Health Organization standards. There aren't clean feeding supplies in shelters. There's no access to bleach, and they lack knowledge that it's essential for shelters. Basically, infant feeding is not treated as a public health issue. Infant feeding, or especially breastfeeding, is not a disease, but it is a matter of public health. Also, ice is difficult to come by. Refrigeration for milk stashes when there's a blackout or there's not a lot of movement means that a lot of stashes can be lost during extended blackouts. So that's another thing that we need to provide education on. A lot of families don't know how to pump milk without power. One of the things that I found, you know that there's these situations sometimes where a baby is not effectively latching to the breast or to the chest, and we recommend that they pump to keep the milk production going. Well, I would go to their home and I would say, are you pumping? And they would say, well, yes, at night when I turn on the generator. In general, there's ignorance about stress, nutrition, and supply. People think that if you're under stress, if you're eating poorly, that your milk supply is going to go down. And this just isn't true. We'll explain a little bit more in detail later. But babies are breastfed in poor countries. Babies are breastfed in countries where there is a lot of civil unrest. There's also a restriction or rationing of clean water. In our case, even clean water was confiscated at some of the ports, and we came to find out a year and a half later that water was being kept and hidden from us in Puerto Rico. Presumably, they said because they wanted to use it for the future, but we've heard later that they didn't want it to interfere with commerce. Once they felt that we were able to buy water, they didn't want to give us these bottled water anymore, even though there were areas that were without water for many months after the hurricane. And in terms of a communications blackout, which happened here because we lost 100% of our cellular towers and many of the internet lines went down. But remember, a hacking situation, an extended power outage in any place can affect access to internet. We also have families that their only access to internet is their phone. And a lot of these applications for assistance, like FEMA, are online, or you're supposed to call in. Imagine not having phone service, not having internet service, and needing to get assistance. So then you have to go to the FEMA center and be in line for 5, 6, 7, 8, 9, 10 hours, and you didn't want to take your baby with you. And as a surprise, now we're dealing with the COVID-19 crisis. This is a little meme that we made because we think that COVID-19 is not being responded to correctly. The government thinks that if they give us food and if they give us money, that then we're fine. The hospitals treat COVID-19 and people who have the illness as dirty, and that the best way to treat the mother or the breastfeeding parent is to separate them and have another person give the bottle. Whereas the World Health Organization recommends skin-to-skin and direct breastfeeding. We deliberately chose this picture of a person without a mask. I know the recommendation is clearly to use universal hygiene and to wash your face and to use a mask, but I would dare to say that breastfeeding an infant without a mask when you have COVID is safer than bottle feeding formula to a baby if there's COVID in the household. The issues at hand, clearly there's a structural challenge of the healthcare system. They claim that one of the reasons they've had us in the lockdown or quarantine or however you call it in your area has to do with the fact that they want to minimize the amount of people that get sick because they're afraid that the health system could collapse. In fact, we have seen this happening in some of these urban centers such as New York City, Chicago, Los Angeles, where there are not enough ventilators for the amount of sick people. And also, there's a human cost, which is the death of people and the fact that people with other illnesses and other diseases and other health concerns are avoiding going to any medical facility. I'm on a chat with some doctors from the American Academy of Pediatrics in Puerto Rico. There's a concern about the fact that people aren't getting vaccinated. I know a lot of people who are asking more in the mommy groups, oh, my baby has a fever, what should I do? People who just don't want to go to the doctor, even though they may, what about your dialysis treatment? What if you need to go because you found a lump in your breast? And people are just staying away from the health facilities. Here are some numbers just to give you an idea. This is through the 14th of June of how things started. So literally in the beginning of March, there were hardly any cases documented in any of these countries. And we can see some of them have a very sharp spike at the beginning and then they start to level off. For example, Spain is leveling off. The UK has a pretty sharp rise. Italy also had a sharp rise, but is leveling. And the United States has a steady rise. We have a steady rise right now. Germany seems to be doing okay. We still have to see. And what about the disparities? It's been reported and it's known. This is just African American, but the coronavirus deaths and cases are disproportionately affecting the African American and Black communities in most states. The orange color here is high cases. So Minnesota, Wisconsin, Iowa, South Dakota, Missouri, Idaho, New Hampshire, Maine, all of these have higher cases for the African American populations. And we also know that for example, the food service or the meat packing industry is primarily employed by Latinx people. And there's a lot of unhealthy conditions in the meat packing plants. Additionally, people of color are more present in service jobs, so they're being more exposed to the virus on a daily basis. We know that on Indian reservations, there is less access to clean water and definitely have been spikes in cases. So race is an issue with the COVID crisis. And I don't know how it is for you all. Maybe this is a place for a waterfall, but what are the birthing and lactation outcomes? We feel like we're going back in time in terms of lactation rights and birth rights. Puerto Rico has some of the strongest laws in all of the United States and territories. We have a law, for example, that says that all infants should be breastfed, and if not, they have to sign a waiver to give human milk substitutes. We also, and there's a fine to the hospital if they go against that. We also have a law that says that the birthing person has the right to 2 companions of their selection during birth. Well, guess what's happened during the crisis? Number one, they've limited companionship to 1 person. And oftentimes the spouse or the mother or the partner of the birthing person is not somebody who's skilled in birth knowledge. And another thing that's happening is that they're not even letting them in until 7 or 8 or 9 centimeters dilation. And this goes completely against our law, but we have an administrative order that was signed by the governor that gives permission to the doctors. It indemnifies them of any malpractice if it was done in the interest of COVID. And of course, we have a lot of cases of separation, even when COVID is just suspected, where the infant is taken to one place and the parent is kept in another place. I'm gonna be surprised to see what the breastfeeding report cards bring us in the next few years. We also have the situation, the uprising that is happening right now, where we are fed up, not just in the United States, but around the world, of the unfair, systemic racism against Black people and Black bodies, which results not only in discrimination from services, but from health, food, anything, and is resulting in death, is resulting in police brutality and a lot of situations. And interestingly, a lot of the uprisings are also resulting in more violence against Black people. What are priorities for infant feeding amidst this whole backdrop? We want to maintain breastfeeding. And so here I want to tell you something very important. Stress does not dry up your milk, nor does hunger. Stress could affect what we call the oxytocin response. Oxytocin is that love hormone that you have when you give birth, when you have an orgasm, or when your milk lets down. If you're under stress, it could be held back. So maybe the milk doesn't flow as freely, you don't have that letdown. The baby may become more fussy. If the parent is educated about this fact, they'll try to relax. Maybe somebody can give them a nice oxytocin massage against their spinal column. But if they don't know, they may think that their milk supply dried up. And then, or they may think, well, I'm not eating well, my milk is not as good. And keeping in mind that formula has literally fallen from the sky. What are you going to do? We want to keep the mother or the breastfeeding parent and the baby together, skin to skin. The priority needs to be on feeding and hydrating the parent. If people want to provide help to babies, they need to be sending food and water to the parent. When combo feeding is occurring, we want to encourage more breastfeeding. And relactation can happen when the baby is being exclusive or almost primarily formula fed. It just requires patience and a lot of education and realistic expectations. We want to educate people on the use of hand expression and low technology tools like spoons, cups, and jars for human milk. We have the best tools right here in our hands. That family that couldn't express their milk until the generator was on could have been hand expressing. And hand expressing is literally more effective than machine expressing. It's just a little bit more tedious. Co-nursing, the use of disposable nasogastric tubes, the use of screened donor milk can also be tools to help families relactate, although we have to consider the hygiene conditions. And keep in mind that breast pumps and bottles are not appropriate donations. Why aren't breast pumps appropriate? Because there may not be electricity. We don't know if it's closed or open system. We don't know if there's a means to sanitize anything and any of the equipment around the breast pump. How to identify needs? Okay, safe formula preparation indications or instructions and choosing to maintain lactation are labeled personal choice when presented to the shelters as an approach to safe feeding practices. I'll give you an example. I went to a shelter, I asked how many infants and young children were in the shelter, and I asked how many were breastfeeding, and I asked if they had any breastfeeding counselors on staff. And what did they do when people had breastfeeding questions? And they just kind of looked at me like, well, that's all a personal issue. The help is generally directed to adults because they're self-sustaining. So what is given to the babies? Oftentimes, the emergency response plans don't include lactation or safe feeding trainings to the personnel. So I remember in the shelters, they were giving education about leptospirosis, lice, influenza, all of the illnesses that were going around. But infant feeding was never touched on as a topic where they had to go to the training. And again, the formula is offered. I remember a mother in one of the shelters who her baby had the 3-week growth crisis. She went to the shelter staff because she was concerned that she wasn't producing enough milk. And guess what they did? Do you think that they taught her about the 3-week growth spurt, or do you think they handed her a can of formula? Human milk and contact parent to infant is treated as dangerous by the Centers for Disease Control and the American Academy of Pediatrics, despite the World Health Organization having evidence-based information that the best thing to do is to keep the mother or breastfeeding parent with the infant. And it's really a shame. And I would dare to say that there's a lot of formula industry influence in the development of these policies. Priorities for infant feeding. We want to discourage formula donation. And it's not that formula is bad, and it's not that babies don't eat formula. The problem is when there are calls for formula during a crisis, if you go and say, hey, please don't ask for infant formula donations, they feel like you're saying, don't help babies. And that's not what we're saying. So the ideal situation would be that there would be very few organizations, like a health facility, a government agency, perhaps a few faith-based organizations or nonprofit organizations that would be responsible for the safe distribution of the formula and that they do it on a case-by-case basis. Instead, what we see is that formula is given to everybody. It's given to every church. It's all around. Everybody asks for it. It falls from the sky. And then it's just this temptation, because we know that the presence of formula when you have breastfeeding problems could cause you to stop breastfeeding. Another thing that people don't know, but actually formula branding is not necessary. It's often predatory. We see these situations where infant formula companies will all of a sudden make a press release and say, we are now producing more of our formula because we saw a shortage in California during the beginning of the COVID crisis. But the press release comes with their name attached to it. The same thing, we shipped 100 boxes of Z brand of formula to Puerto Rico. It's all a publicity stunt, because something that people don't know is that formula, it doesn't matter what the brand is really all the same. What's important is the type of formula. And for example, you have a milk-based formula. I'm gonna say brands here. I wanna make it really clear that I don't promote any brands. We are WHO compliant, but at least in Puerto Rico, the brands that we have are Similac, Enfamil, Good Start, and then the generic brands. There's also some organic brands, but they're marketed more towards toddlers. If you don't have Enfamil, you can give the baby Similac. If your baby is on a hypoallergenic formula, Alimentum, Nutramihang, and Gerber HF are all the same thing. It's sort of like if you always eat a certain brand of beans, and here we have a brand of beans that people like, Goya brand. If those beans are not available and somebody comes and brings you Great Value brand beans, you're not gonna throw that can of bean in their face and say, take this crap away from me. You're gonna eat the beans. Well, the same thing goes for infant formula. In fact, we even have learned through a World Health Organization curriculum that in a case of crisis, you can actually make an infant formula using cow's milk, and diluting it with water and adding some sugar and fat and maybe micronutrients. This isn't something you want to do on a long-term basis, but it is something that you can do if there's nothing else available, because you don't want to then give the baby, I don't know, like mashed carrots if you don't have formula available. Because the fact of the matter is, what is infant formula? Infant formula is diluted cow's milk with added fats and micronutrients. If formula feeding is necessary, the ready-to-feed infant formula in individual bottles is the least risky. Why? We don't have to wash those baby bottles. And even though it produces more trash, it's something that would be safer and cleaner right at the moment. If we do have to feed formula from a separate container, we need to make sure that the bottles that they use are sanitized, what we used to call sterilized, okay? So the best thing to use would be a disposable cup, but reusable cups are easier to clean than bottles and teats, and they don't have to be sanitized. The one problem is that liquid formula is expensive and it's heavy. So somebody who wants to buy infant formula or is sending infant formula doesn't say, oh, how can we send powdered death to this community? They want to buy more formula for the babies so they can do so by buying the powder. And the other thing is that liquid formula is heavy. So it will cost more to ship it. It will weigh the plane down so that you could literally ship less. So the reality is that most disaster sites are going to receive powdered infant formula. And that, for example, is what the WIC distributes. What's important to know is that it has to be prepared with clean and freshly boiled water and served in sanitary equipment. And when I say freshly boiled water, it doesn't matter if you're using water from the bathroom sink or if you're using the most expensive brand of bottled water. The reason is because powdered infant formula is not sterile and could contain dangerous bacteria. Literally, once you open it, it also can collect more bacteria from the air. By boiling the water and preparing the formula within 30 minutes or less of the water being boiled means that you are killing the dangerous bacteria in that formula. And then you can wait for it to cool down. It'll last 2 hours at room temperature, 6 hours in a portable cooler, and 24 hours in your refrigerator. How do you sanitize that previously called sterilized feeding equipment? First, you want to clean everything with soap and water. If you have like a teat, you want to get a brush and get it to all the nooks and crannies. You can boil for 5 minutes. That's when you have enough water. If you don't have a lot of water, but you have some water, you can just put an inch of water and put a steaming basket, put it in a pot, put a top on it, and steam for 7 minutes. There's also microwave steamers, but here then we would be assuming that you have electricity. Cold water sanitation. This is something that a lot of people don't know about, but it is literally 1 tablespoon or 15 milliliters of unscented chlorine bleach, and you mix that with 1 gallon of water. You submerge the feeding equipment in that solution for 2 minutes. You take it out, you let it evaporate, and it is completely clean and safe for any baby to eat from. So you don't have to have heat, and you don't have to use dirty bottles. Either you sanitize or you use cups. This is the way to sanitize. When clean water isn't available, you can literally collect rainwater. You can use river water or water from the lake. There, I would suggest you use gloves when you're collecting water. Then you can strain the sediment out of it. You can boil it then for 5 minutes, or you can add 8 to 16 drops of bleach. 8 drops if the water is pretty clear, 16 if it's still cloudy. You wait half an hour, and that water is potable. And you can also buy very high quality water filters. We received some water filters here after the hurricane, and I'm still using it at home. It filters bacteria, it filters heavy metals, it filters other things, so I don't have to depend, I don't have to boil the tap water, and I don't have to depend on bottled water. And why do I say this? Bottled water is a public health crisis. If you're still using bottled water, I really, really want to encourage you to consider buying a filter, because all bottled water is filtered tap water. And the amount of plastic waste that is being produced because of our new bottled water culture is scary. And if you ask me about recycling, recycling is a scam, because the only thing that recycling does is conserve space in landfills. It uses the same amount of energy as it would be to make new plastic, and it releases toxic gases into the atmosphere. There's an organization in Puerto Rico which studies the toxicology of mothers and infants from pregnancy until age 5 of the child. And one of the things that they found after Hurricane Maria is that the amount of plastic in the human body had increased exponentially. And that has everything to do with bottled water. Some priorities that we can have as infant feeding specialists. Let's rely on community health workers and peer counselors as first-line workers. Breastfeeding and infant feeding is not an illness. Let's keep the health professionals where they need to be, intervening with bigger health crises. And let's have our community health workers and peer counselors doing the immediate triage response. So we can train mothers and families, even non-traditional service personnel, for example, hairstylists, retired people, churches, so that they can be those first responders in emergencies to infant feeding. Then the IBCLCs, the CLCs, the other lactation specialists can either be part of those lower skill community health programs, but they can also be part of integrated health worker teams in allied health organizations where doctors, nurses, midwives, dietitians, dentists, all of those health professionals are working. We can go up or we can go down. It's ideally we should be working on preventive disaster plans, but involve community leaders, peer counselors, community health workers, the health teams, breastfeeding coalitions, lactation specialists, and public policymakers, and that this would happen before the disaster. You should always try to maintain a high profile as an expert in lactation in your community so that people will seek you out in time of need. Keep facilitating and promoting support groups in your community. Right now, we're online. We have 3 support groups a week. We have one which is just discipline, and we have 2 that are infant feeding. We're using an online platform. We're starting to visit people, but we want it to be a situation where people say, oh, there's that woman who lives in the blue house who can help you. Or, oh, my cousin's friend is somebody who I know can help you. So that there are a lot of experts in the community, not that you have to wait until your WIC office opens again, or you have to wait until your clinic is receiving personnel to attend you. During non-emergency times, hand expression and sanitation needs to be a constant lesson. So we as an organization, at every support group that we have, even when there was not a crisis going on, we were always teaching hand expression. You can share videos with people, or you can just show them how to do it if you're not in person with them. And we need to be training health professionals, community health workers, peer counselors, public and customer service professionals and community members to be those triage workers in IYCFE. If everybody knows, if there's a uniform response, things will go a lot better. We should be offering mentorship to lesser trained workers. One of the things that I always tell my peers is that we need to be training our predecessors. What would happen if you were not here tomorrow? Does this mean that infant and young child feeding in your community would no longer be safe? Or does it mean that the people that you trained would be taking on the job and that everything would continue to flow freely? What can lactation specialists and birth workers do during or before and after crises? The first thing we want to do is secure our own safety. So there was an earthquake. Part of your roof collapsed, but you're okay. You want to make sure that you put something over your roof so it doesn't get rained on the next time there's a crisis. You want to make sure that there's food for your family. So you want to make sure that you're okay first. But then you want to determine where you're most needed. You may be most needed at the shelter. You may be most needed where a landslide occurred. You may be most needed at the hospital, or you may be most needed at home answering telephone calls. You want to assess and document what are the concrete barriers to safe infant feeding in your area. For example, what are the businesses that are closed? What roads are blocked? What are different problems that are happening very specific to your community? And document those, because those can be used in the future for public policy so that you can say, hey, remember when we had this other crisis, this happened and this happened. Or to say, we need some of this right now because we don't have access to this community. Ideally, the triage workers that you trained are already going to be in the communities, and then they can work on these more simple tasks like teaching latch, hand expression, answering questions. As we know, a lot of infant feeding and lactation help is just listening and counseling and reassuring. And people need a lot of reassuring during a crisis. Again, promoting the low-tech interventions. We could have pop-up clinics. We can have community brigades. We can go to where we're most needed. Right now, if we do that, we just need to practice more care. We may need to use face masks. We need to wear gloves. We need to practice social distancing. But we are at a time where now we can do some more public awareness, or maybe we use Zoom as a platform to get the information out. We just have to assess what is the different situation and what are the needs. And if you're going to go visit another community, please make sure that you're going there because you were invited to go there. Contact the local breastfeeding specialists and birth workers. Please don't displace them. I have stories. We're in Puerto Rico. I cannot tell you how many people hablan español así that come from outside and are getting paid 2 to 3 times what we get paid to do what we're perfectly capable of doing here. Collect statistics. Gather stories, write briefs, write articles, participate in any committee, in anything that's going to help create public policy, even where you think you may not be as needed. For example, I attend the Children and Youth Task Force of Puerto Rico. A lot of what they talk about there is childcare and school, but I am there always talking about infant and young child feeding. Protest. Network with your legislators to draft bills or sign administrative or executive orders that preserve our rights. Breastfeeding and accompanied birth is a human right, and it's being violated right now. We should be lobbying for insurance reimbursement for all lactation and birth worker interventions, not just a select few. You don't have to be a nurse with a CLC to get reimbursed. You don't have to be an IBCLC. You don't have to be a doula that was trained by a specific school of doulas. We want people to be paid for what they're worth, because then more of us will be available. And in the end, the cost to the health insurance companies is less. if they realized that putting less money up front would result in a lot, not having to put so much money at the end. The health costs related to formula feeding are high. We want to emphasize equity. We want to make sure that services are equitable and are not just directed to one population. We want to use intersectional language. I think it's important to point out that there was a study by GLAAD in, I believe it was 2016, that indicated that the millennial generation, up to 20% identify as being LGBTQIA+, and approximately 5% do not identify with the gender that they were assigned as birth. When we use binary and gendered language, we are not speaking to millennials. And we need to stop relying on the government to rescue us. And this is not to say that the government does not have a responsibility to respond and to help us, because they obviously do. But if we're going to sit around waiting for them, the fact of the matter is that community health workers, community-based organizations, neighborhoods are often the ones who respond best and know what's going on in their communities. So here we put together 16 vital tips and actions that you can take. Some of this may be repetitive, but number one, government public policies have to stress that breastfeeding is the safest way to feed a baby and have a list of lactation resources available before the crisis, so that when the crisis happens, it can just be shared and will be the uniform line of all of the governments. During disaster season, if you have one, or year-round, we need to continue to have public education campaigns that remind us that breastfeeding in emergencies saves lives. We want to make our public awareness campaigns current and relative on what to include in the survival kits. A lot of times the survival kit will mention infant formula. Well, there's more families that are breast or chest feeding right now. So we want them to say, if the parent is breast or chest feeding, there should be more water for that person in the kit and more food in that kit. We want to include also campaigns on the safer formula handling and the preparation according to the World Health Organization guidelines. Remember to let people know that stress doesn't dry up milk, so it's let down versus lower milk supply. Remind people of that. Stress is not going to dry up your milk. If there are lines for help or for food, there's, like here, for example, in Puerto Rico, we have priority lines for disabled and for elderly and for pregnant people. I believe that those lines should also give priority to parents who are breast or chest feeding their infant, because this is going to be a way of encouraging them not to miss a feed. And then the shelters need to encourage breast or chest feeding as a primary option. Ideally, there would be lactation counselors in these help hubs, or at least somebody that you trained as a triage worker. There should be public campaigns that discourage formula donations to breastfeeding families and shelters. The public education should include adequate information on how to safe keep your human milk stash. And the government should provide locations to store and refrigerate human milk when there's going to be extended blackouts. Identify a place where it can be done. Maybe it's going to be one of the shelters. Maybe it will be a hospital. Maybe it could even be a business. But there needs to be a place, if there's going to be a blackout, where families know that they can take their milk and their milk will be safe. Again, we said breast pump donations are just not safe or viable. So we need to continue educating on hand expression. Consider safe co-nursing and donor milk when it's needed. And remember, sadly, donor milk is often not offered to communities of color. They just assume that we're not going to want it. The food donations for adults, toddlers, and children should be healthy. The guidelines from the World Health Organization say that it shouldn't have added sugar, it should be low in sodium, and should be low in saturated fats. Remember that food box and that meme that I showed you earlier? I got Frosted Flakes in the food box that was put in front of my house from my municipality. And when I complained about it in the chat with the other moms from the school, they called me ungrateful. The private formula donations need to be kept by the proper government division, and we should try to prohibit private organizations distributing it unless they're properly informed in how to give breastfeeding support as a first choice, what is a use by date. All formula cans have a date on it, and that is the last date that the formula can be used. It's not the last date it can be sold. It's not the last date it can be opened. Literally needs to be used by that date. And I think we still have formula running around Puerto Rico that they sent here in Maria that people are trying to get rid of. Donated formula can be rebranded. You can put a generic label on it, because I told you it's like the beans. And ideally write on it not for resale, because sometimes there will be predatory people that will come in that will pick up formula donations and will try to sell it, or in good faith will try to redistribute it. But again, they don't have the information on who really needs that formula. And remember, if you do decide to donate formula, try to donate ready to feed and single feeding sizes. Try not to donate powdered infant formula. And if you do, include the World Health Organization guidelines on formula handling. We have a cheat sheet that we made that we can provide to Health Connect One if anyone's interested in it. That's both in English and in Spanish, that gives you all of the vital tips on how to do safe infant and young child feeding. And it includes the safer formula preparation. Unlabel the formula tins if you donate them. Again, scrutinize the formula a little bit further and try to ban the call for donations for formula. Make sure there are clean and designated areas for infant feeding in shelters. And no relief support should displace or disregard local resources. Here is an example of some low-cost tools that we used. If you look to the left, this is a silicone milk collector. Sometimes people call it a pump. They use the brand name. I'm not going to mention the brand name. Number one, because it's a company that violates the WHO code on marketing. But number two, because you can get good quality, cheaper versions of the same collector. And then if you look to the right, these are the Relaxation Kits that we used. We include 3 syringes. One is a 60 milliliter or 2 ounce. One is a 30 milliliter or 1 ounce. And one is just a 3 milliliter. The little syringe is to clean out the nasogastric tube. And if you look at the white part on that tube, it locks into the syringe, and you can use that as a relactation kit. You don't have to buy that expensive $50 or $20 thing. These kits cost about $7 to make. And I'm going to show you a video now. Thank Mariel Alvarez and Aunar for this beautiful video.
Me integré así en octubre del 2017, cuando vimos la necesidad luego del paso del huracán María. Nos juntamos para ofrecer servicios de manera voluntaria a todas esas comunidades que habían sido impactadas fuertemente.
Orientar a estas comunidades y encontrar personas que pudieran ayudarnos a poder llevar el mensaje, a poder ayudar a más personas. Nos hemos preparado todas bajo el mismo currículum también, porque todas hemos recibido las mismas orientaciones. Dolía mucho ver el sufrimiento de todas estas familias. Fue como bien cuesta arriba para nosotros.
El trabajo que nosotros hacemos pone en evidencia la inequidad en la que vivimos.
Una de las cosas que yo recuerdo es la sensación de no poder poner en práctica nada de lo que yo tenía como conocimiento como médico, porque no tenía ni cómo llegar.
El tener que meterme en sitios sin tener comunicación alguna.
Mi bebé nació un mes después de María, el 20 de octubre. Pasé una depresión postparto fuerte. Yo nunca había sentido las cosas que sentí durante ese año después de María.
Todas estábamos en la misma incertidumbre. Recuerdo cómo queríamos trabajar, pero ahora lo veo y estábamos igual de cansadas, pasando la misma necesidad nutricional, de no tener cuidados médicos o de salud. Wow.
Muchas de las madres o cuidadores bajaron producción, querían relactar, saber qué alimentos podían ofrecer a sus infantes. Había que asesorar a las familias en la forma segura, en cómo brindar la fórmula, cómo extraerse con las manos para que pudieran relajarse en medio de la situación.
Luego del terremoto fue más allá de profesional. El epicentro en mi hogar. Cuando fui como otra guaniqueña más.
Realizamos unos kits de higiene para poder potabilizar las aguas que estaban haciendo tanta falta, poder ayudar también a las familias en los refugios.
Que para fomentar esa comunicación de par a par es bien importante el hablarnos de tú a tú y escuchar realmente cuáles son las necesidades de la persona, las preocupaciones, las limitaciones de acceso, apoyar sin juicios sobre todo.
Fui a casa de una mamá primero a ayudarla en una relactancia. Esa misma mamá me recomienda a otra amiga que también era de por allí. Al salir, ella le dice al esposo, mira, esta fue la muchacha que me recomendó tal persona. Entonces él estaba ahí con todas las personas de la comunidad y todo el mundo empezó a aplaudir. Y yo salí llorando de allí, que yo dije, estoy haciendo un buen trabajo. Otra experiencia que a mí me impactó fue cuando yo vi algunas latas de fórmula llenas de hongo y esas mamás tan, ¿verdad?, nerviosas, ansiosas. Y algo bueno que salió de ahí fue que también se trabajó relactancia. Me encontré a una en el supermercado. Cuando esa mamá me vio, me dijo, mira, estoy lactando todavía y esto fue gracias a ti.
El haberme involucrado en así fue bien positivo. Me cambiaron la vida a mí y han hecho que yo haya puesto un granito de arena en muchas mamás que he ayudado. Y conocer tantas personas que sé que necesitan de los consejos sobre alimentación y llegar a más personas de las que pensé llegar fue demasiado gratificante, porque al sol de hoy todavía sigo siendo esa voz de así en Guánica.
Me veo una persona empática, escuchando las necesidades de la familia, de las madres o cuidadores.
La realidad es que adquirir conocimientos no tan solo de personas profesionales en el campo, sino de madres, padres, cuidadores con la propia experiencia, beneficia y enriquece mi conocimiento y sobre todo la empatía.
Vamos con el propósito de ayudar a estas personas, pero a veces aprendemos hasta mucho más.
A mí me formaron las mujeres y las familias a quienes yo apoyo.
Yo me siento bien contenta y bien orgullosa de ser parte de esta organización.
Me considero consejera aparte.
Soy doctora, también soy cacica de así.
Soy cacica.
Yo soy cacica de así.
Soy cacica.
Soy cacica.
I know I went a little bit over. I don't know if we have time for question and discussion, but I really want to thank you. Here are our references. And I think we took the slide out, but oh, it's right here. If you're interested in this topic, this manual can be downloaded from the IFE core group. Just look it up. It's called Infant and Young Child Feeding in Emergencies. If you put IFE on your search mechanism, you'll be able to find it. Thank you.
Thank you, Lourdes. We are out of time, but you were really thorough. If there's any questions, if you have a moment, have a minute or two, Lourdes.
I'm able to stay online and Godming is here too. So if any of you have to go, I really apologize. You can write us directly. But if any of you want to stay on for a few minutes, we're willing to answer questions.
And there were some questions, but it was just about your brochure and what was something downloading, which Sadie's going to send the brochure you were talking about. Sadie will send the link. Sadie's putting links up there right now. So if you're still there, and when we send the evaluation, you will also get the links to this webinar. Brenda?
Thank you so much, Lourdes, for that powerful presentation. We're so grateful for your time and for showing us and sharing your learnings in Puerto Rico and how, as a community, you've been able to manage all the different emergencies, COVID on top of it, civil unrest, and so much more. So we're so grateful for your time, grateful for all the casicas, the consejeras de lactancia materna, Carmen. Thank you so much for your time. I think there was just one question. Would people, are you okay, comfortable with them getting your PDF of your PowerPoint?
No, we're not going to share the PDF, but we will share with them the express guide that I mentioned. I'll send that to Health Connect One, and you can pass that on. Okay.
Sounds good.
Because
That
it includes all the information on how to disinfect, how to it comes up with many of the issues. It's going to be more useful for you.
All right. Thank you. Thank you so much. Thank you for everyone that joined us. Grateful. Thank you.
And if you know anybody who's interested in the same topic,